So there's a couple of questions about instability at the craniocervical junction. So I guess before we even kind of really address any of them, so how do you diagnose that? What are the measurements or the tests that you do, I guess? And then how do you know what the right situation is to do a surgical, like maybe even a fusion in that case?
Yeah. So the first way to look at it is the initial MRI scan. So everybody with Chiari is getting initially diagnosed on MRI. So we're going to look at a couple things. We're going to look at the angle between the base of the skull and the cervical spine, right? If it's normally it's about 150 degrees. Sometimes it gets really acute though, and that's a sign that things aren't normal. We look at the back part of the dura as it's. You better have a picture, but. If it looks like the top of the spine is kind of tilted back into, like poking into the brainstem, that's a possible sign of instability. We look at the joints. So there's actual joint, just like your fingers and knees, etc. There's joints between the skull and the spine. So we look at the joints themselves. Are they normal width, or are they a little bit bigger than they should be? Is there excess fluid in the joints? That can sometimes be an indication that there's instability. And then one of the best ways to assess that is actually to look at how things move. Now, some places you can get a flexion or an extension MRI scan. So you actually get an MRI in each of these positions, but that's kind of hard to find. What everywhere has available is flexion and extension X-rays. So you look at how the bones move relative to one another when you flex and extend the head. Now, making the decision about how unstable any given patient is and whether fusion needs to be done at the time of the original surgery, that's quite a complex decision. Sometimes it's easy, right? Everything looks really abnormal. The X-rays are very unstable. Like every surgeon is going to say, yeah, that child needs a decompression and a fusion together. More often, it's a bit of a judgment call, and sometimes we may get it wrong. Right? We may think this is not that bad. We do the decompression. Things don't get better, and then we have our follow-up MRI scans. We see that, oh, those angles actually look a little bit worse now. That's time to go back and do the fusion. Now, does that mean it was wrong to not do it to begin with? You could look at it that way, but at the same time, fusion's a much bigger operation. It really limits your cervical mobility. So we don't like to do them if they're not necessary. It also has a higher complication rate. It's a harder surgery. It's a bigger deal. So we try to kind of do them only when necessary.
Yeah.
But the truth is that's an individualized decision based on a lot of factors.
Yeah, that's a good answer.